Hi, my name is Alyssa and I'm from Group 25. Today I will be explaining about different types of surgery. So what are elective surgery and what are emergency surgery? So an elective surgery does not always mean it is optional. It simply means that the surgery can be scheduled in advance. It may be a surgery you choose to have for a better quality of life, but not for a life-threatening condition. But in some cases, it may be for a serious condition such as cancer. Sorry. Examples of elective surgery include like removing a mole or a wart and having kidney stones removed. It may also be done if other forms of treatment are not working. So what are urgent or emergency surgery? This type of surgery is done because of an urgent medical condition. The condition may even be life-threatening. For example, if a patient have acute appendicitis and even trauma. In this case, the patient needs emergency surgery. So you might be wondering, how can we differentiate if the surgery is elective or if the surgery is emergency? So what are the common elective surgeries? A wide range of surgical procedures can be elective, such as cosmetic surgeries, cleft lip repair, ear tube surgery, tonsillectomies, removing the tonsils, or adenoids to treat the obstructive sleep apnea, and also bariatric, which is the weight loss surgery, hernia repair, undescended testicle surgery, eye surgery for cataracts or strabismus, spinal fusion surgery for scoliosis, and surgery for sport injuries. The surgeries done electively, they are often important and potentially life-changing operations. Some are same-day surgeries that don't need a hospital stay. Kids can go home the same day after a brief recovery period. For other surgeries, kids might need to stay in a hospital overnight or for a little longer. While emergency surgery required to deal with an acute threat to life, organ, limb, or tissue caused by external trauma, acute disease process, acute exacerbation of a chronic disease process, or complication of a surgical or other interventional procedure. So the skills needed for emergency surgery include the ability to undertake those abdominal, including urological, thoracic, vascular, and soft tissue procedures that need to be performed within 24 hours. And the emergency surgeon needs to be able to assess the need for surgery, know when to involve help from other specialist surgeons, and be able to perform the life-saving procedures as above. He or she needs a good decision-making skills, must be a good communicator, and be able to coordinate the care of patients with complex problems. The emergency surgeon must understand the physiological of acute disease, how it is influenced by pre-existing comorbidity, and be able to rapidly optimize the acutely ill surgical patient. So critical care is best delivered by specialists in intensive care medicine, but the emergency surgeon should be actively involved in this process. That's all. Thank you so much for your attention.